Management of blood and body fluid spillage. Spillages of this kind are highly unpredictable and can happen at any time and in any area within the care home environment. All spillages of blood or body fluid should be considered as potentially infectious and the standard infection control precautions observed. All staff in the home should be trained to clean a spillage of blood and body fluid. The person witnessing or discovering the event should deal with the spillage immediately. This will reduce the risk of exposure to infectious agents, further contamination or accidents. Spillages can consist of blood and body fluids, for example, urine, vomit, feces. When a spillage occurs, you need to do an assessment of the content of the spillage. Does it contain blood, urine, vomit or feces? The size of the spillage. The material on which the spillage has occurred, fabric, vinyl, metal, and based on your assessment, you need to take the appropriate action to clean the spillage effectively. Personal protective equipment such as disposable gloves and apron should be worn to prevent skin exposure or contamination of clothing. Face protection may be needed if it is suspected that there will be splashes to the eyes or mouth. The correct colour-coded equipment must be used and waste must be discarded into the correct coloured waste bag. For blood spillage and body fluids, spillages with visible blood, a kit may be available to you. These kits contain a range of products to help deal with the spillage effectively. If the spillage involves blood and body fluid, but not urine, vomit or feces, wearing PPE, apply chlorine-releasing granules or solution to the spillage, ensuring the spillage is completely covered and saturated. Manufacturer's instructions should be followed to ensure the correct strength is used for the correct contact time. This is usually a few minutes. Try and ventilate the area by opening windows and doors. If a spillage is on soft furnishing, chlorine-releasing agents must not be used. Wearing your PPE, wash the area with a disposable towel using detergent. Allow to dry. If the spillage you are cleaning is urine, vomit or feces without visible blood, remove any gross soiling, for example, vomit or feces, with disposable paper towels before cleaning the area with chlorine-releasing disinfectant diluted to the correct strength. Follow manufacturer's instructions for strength, quantity and length of time the disinfectant should be applied. Note the strength of chlorine will differ for spillages of blood and body fluids or for urine, feces and vomit, so you must check manufacturer's instructions. Discard PPE and carry out hand hygiene. Grossly soiled carpets or fabric items in shared accommodation should always be replaced. To break the chain of infection, remember, deal with all spillages immediately. Use protective clothing. Always use chlorine-based disinfectant for blood spills and follow manufacturer's instructions. Do not use chlorine-based products on soft furnishings. If using chlorine-based products, always ventilate the room. Dispose of all used items in the correct waste container. Wash your hands upon completion.